Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, today's topic of discussion didn't come from anyone in particular. It's just as a result of recent cases that I've been seeing, and a few of my colleagues, especially one of my colleagues in South America. We were in discussion yesterday with regard to how many patients were coming in and discussing experiencing pain in a particular body part, especially at night. So I felt I'll take a break from requests in this podcast to sort of, elaborate on if you're feeling pain in this particular body part at night, it's best you see your acupuncturist right away. And also, you can see your doctor as well. And this type of pain, I know we all experience, sore muscles here, headaches there, elbow pain here and there, lower back pain. But if pain anywhere in the body keeps coming back, it should warrant you to see an acupuncturist or your doctor, or better yet, both an acupuncturist and a doctor. But if you notice one particular body part that hurts you at night, it's a disorder that you shouldn't ignore. And believe it or not, and this is knee pain. And I'm not speaking of knee pain that you may experience at night after a full day of running around on your feet so much, and whether it's job related, exercise, or training different people, whatever. I'm speaking of knee pain that basically comes just about every night when you're relaxed, you're lying in your bed, and you're not putting any stress on your knees. Because knee pain can come and go for anyone. But if you find it recurring at night, see your acupuncturist. Because it can be the result of a much larger issue. And it's often due to arthritis, more so osteoarthritis. Because people that have normal, healthy knees don't face recurring knee pain at night. That's the difference. And you have to keep that in mind. Sometimes we may overdo it during the day and as we're going home or whatever, or when we sit down, let's say for about an hour, early evening, and we stand up, we feel some stiffness of the knees, a little soreness. It's okay. But what happens here is, if you go to bed, you lie down, and your knees are killing you, that can very much be a sign of osteoarthritis, which is basically a condition, caused by wear and tear of cartilage, which is basically the protective tissue of your bones and your joints. And it can include symptoms such as swelling, a feeling of warmth, more so in the joint area. And also, if you're hearing like cracking sounds when you move your knees, these are signs. And the reason why, speaking with a colleague from South America last night, when we closed the clinic here in New York City, was, I had a few patients, more than normal, come in over this past week complaining of knee pain while they were lying in bed, off of their feet. And they couldn't understand it. And sometimes they couldn't sleep. It would wake them up in the middle of the night and so forth and so on. And, I'd assessed them, made my own diagnosis, and began treating. Now, they felt immediate relief, but, sometimes after your first treatment, the pain may come back, and I always inform my patients that can happen. But if you stay consistent for a few sessions, a lot of times it goes away permanently, and sometimes it takes longer to come back. The pain grows further and further apart. And there are several reasons as to why it can eventually come back, but a lot were surprised, because some have even asked their doctors why that's happening and couldn't get a clear answer, but then they went back and were assessed, were examined and assessed for osteoarthritis, and voila. Some were sent out to specialists for that to be determined, and were surprised. And here at Acupuncture is My Life, we receive plenty thanks for not isolating our specialty, not isolating what we do to say that, it all happens here. We fix everything, because we don't do that. I say this over and over, whether it's over podcast or YouTube, and even to patients that walk in my office. Eastern and Western medicine combined, forget about it. Many people enjoy the relationship. Sometimes you just need acupuncture between herbs, moxibustion therapy, cupping therapy, and so forth and so on. And then there are times where it's best to see your doctor and your acupuncturist, because allopathic medicine has its benefits just like acupuncture has its benefits. And you have to understand that. This is why, again, I say follow us on every social media platform under Acupuncture is My Life, with the exception of Twitter, which is Acu_is_my_life. Follow us on YouTube. Watch the videos and learn more about acupuncture. Go to acupuncturismylife.com and subscribe to the weekly newsletter. And twice a week, you'll receive emails with tons of information as to how you can benefit from acupuncture. We offer so much information at no cost. And if you want to engage in private chat sessions, just simply go to the Google Play Store and download the Acupuncture is My Life app. To do that, and then to gain access as a result of downloading the app to free telehealth services. We do telehealth services with people all over the world. All over. Africa, Europe, Australia, China, Japan, different areas of the Middle East, South America, Canada, all over. It's beneficial in so many ways to follow Acupuncture is My Life. And tons of people from different parts of the planet have relatives that fly into New York City, and they come into the Acupuncture is My Life clinics. But there's so much to learn, because to see the faces of individuals who did not realize that this pain that they're experiencing every night, when they're not even on their feet, every night, their knees are killing them when they're lying down, and it obstructs their sleep as well. They did not have a clue that it could have potentially been due to osteoarthritis. Now, that's not the only reason, but they didn't have a clue that was the case. Osteoarthritis is the more common form of arthritis. But that doesn't mean that it doesn't come with serious complications. Because knee osteoarthritis, remember, it's more likely to occur during the night. And as I said, it will disrupt your sleep, which reduces your level of productivity the following day. You don't want your sleep patterns to be disrupted, because that can lead to a myriad of other issues. A whole line of other issues that you'll definitely be seeing an acupuncturist for. So if you feel yourself experiencing knee pain at night when you're off your feet, lying down, or in an ottoman, reclined, or in some type of recliner, think to yourself, I need to go see an acupuncturist, or I need to contact Acupuncturist in my life. As a matter of fact, I'll help you. Close your eyes. If you're sitting down, you're not really moving around too much, even lying down, close your eyes. Say to yourself, acupuncture is my life. Then open your eyes. And think about whatever ails you and the fact that you have to contact Acupuncture is my life to discuss it. But you don't want your sleep patterns disrupted. And knee osteoarthritis can also cause weight gain. Because it triggers a desire to want to just sit down. And the human organism is designed to be active, with the exception of when you're asleep. So if you're experiencing knee pain, especially at night, see an acupuncturist. Because this can progress into a stage 4 severe case and can require bone realignment surgery or total knee replacement. You don't want that. You don't want that. This is why I say over and over, Acupuncture is my life is here for you. You have no excuse. Oh, I didn't know acupuncture can treat this, or I can benefit from acupuncture relative to whatever. You have no excuse, because there are a few that'll come in because they may have seen the logo somewhere and say, hey, I always thought about trying acupuncture. And they'll come in and I myself, along with other practitioners here at Acupuncture is my life, we'll ask the question, well, what brought you into this? Oh, I just thought I'd try acupuncture. But then suffered from a myriad of disorders for so many years, and then when they find out they could have benefited from acupuncture relative to those disorders a long time ago, a lot get upset. So this is why we do what we do. This is why, we're listened to on up to 7 different continents at this point. And so many people are learning the many ways in which themselves or a loved one can benefit from acupuncture. And they're reaching out to Acupuncture is my life with no regret. None. To this day, we have not heard from one patient, one individual say, I wish I'd never contacted you guys. Acupuncture's horrible. Nope. So you see, following us is extremely important, because you get to a point where you need bone realignment surgery or total knee replacement, and you've made the decision to go that route. Good luck. And I say this because we've seen and still see post surgery, knee replacement patients on a regular basis. Well, what are you coming in to see us for? Knee pain, pain in the surrounding areas of the knee replacement. So think about it. Because you see, osteoarthritis becomes more of an issue, or can become more of an issue, for individuals after they turn 45. It can even occur at a young age as well. And, how can it occur in someone at a young age, you would ask? Would be due to weight. It can be hereditary. Females tend to experience this a lot. Athletes from repetitive stress injuries, metabolic disorders. There's a myriad of reasons as to why someone at a young age can experience osteoarthritis. And there can also be other reasons as to why your knee would hurt at night. A person can experience patellar tendonitis. Which is caused by inflammation of the tendons of your knees. Acupuncture, hello, treat that as well. There's so many ways in which an individual can benefit from acupuncture. There's no excuse as to why you're not in touch, or your colleagues or loved ones or relatives are not in touch with Acupuncture is My Life. Because you're more likely to notice knee pain at night for two reasons. As I stated, one is osteoarthritis or patellar tendonitis, because they tend to hurt more when you're at rest. So those are clear signs of a problem. And if you leave this untreated, it's going to get worse. This is why you should contact your acupuncturist, or Acupuncture is My Life. Take a second and think about it. We're here for you in more ways than you can imagine. So keep in mind, if you're feeling knee pain when you're at rest at night, think osteoarthritis of the knees or patellar tendonitis. Get on the phone with your acupuncturist immediately. And if you don't have one, or there isn't one near you, contact Acupuncture is My Life immediately, and we'll take it from there. But other than that, Acupuncture is My Life. What's yours?